Divergente Meridian, die Kollateralen und der Hauptmeridian vom Yang-Ming-Dickdarm interagieren.
So you don't have to keep turning the page to look at the collateral vessel and then the divergent channel. It's all in one little image and the structures that it interacts with. So the nose, no surprise there.
Nase.
The ear, though, you don't always think of the Yang-Ming channel in ear problems. Of course, we think of the Sanjiao channel in kidney. But sometimes you might find, and I had a case in the student clinic of like an ear that wouldn't open, like it felt like there was water and they couldn't get it out. And large intestine 4, not surprisingly, was the point that really helped it. We didn't think of that right at first.
Denkt man beim Ohr nicht zu sehr Yang-Ming-Dickdarm. Aber er hat einmal einen Patienten gehabt, wo das Ohr so verschlagen war und da hat Dickdarm gut geholfen.
So lower teeth, you already knew that. But really, upper and lower, the teeth and jaw, all can be...
Something
yes.
interesting to add.
Yes.
Modern research has shown that in many chronic otitis children, patients, they found this bacteria Helicobacter in the ear, which is normally said to be in the digestive tract, in the Yang-Ming.
All right, we should tell those guys.
Es gibt so Untersuchungen, dass man bei chronischen Mittelohrentzündungen sehr oft Helicobacter nach bei Kindern jetzt gefunden hat. Yang-Ming.
Excess, you might even bleed large intestine 1 for ear problems.
Bei Fülle-Ohrstörungen kann man Dickdarm 1 auch blutig haben.
Lower teeth, no surprise. You knew that. Throat, everything's in the throat. Lung, large intestine, no other surprises.
Nothing new.
Okay. All right. As we begin palpating, Dr. Wang does check around large intestine 4, the source point, for blood stagnation patterns sometimes up in the head and face. Doesn't make sense at a source point, but he does find tension and adhesion there in the head and face.
Obwohl es ein Quellpunkt ist, sucht Dr. Wang bei Dickdarm 4 nach Blutstasezeichen für Probleme im Gesicht und Kopfbereich.
The other thing, of course, is using large intestine 4, or as David is fans of the Dong style stuff. Either way, Linggu Dabai, large Yang-Ming, large source point area, there'll be tension on one side and not the other sometimes. What I'm calling squeezed. It feels like there's a lot of tension, imbalance, left and right at large intestine 4 and back pain.
Manchmal findet man bei Rückenschmerzen ein Ungleichgewicht rechts und links von dem Bereich. Also der Jason nennt das squeezed, das ist wie zusammengedrückt. Also man kommt nachher beim Palpieren nicht so tief rein auf einer Seite wie auf der anderen Seite.
So comparing left and right in musculoskeletal patterns, always the case. So instead of nodules, in other words, we'll feel it on some people. It just feels like there's an imbalance, like there's something tight or stuck on one side and not the other. Maybe some of you already know. Not over, if you get over just a tiny bit, you'll start to feel the Sanjiao channel. So it'd be really right through here when palpating the large intestine 6, 7, 8, 9, 10. It's right through there. So this is the easiest channel to be in the wrong place, I've noticed. It's the large intestine. You'd think it's full of qi and blood, it would be nice and big, but the important spaces are very, very small. The Sanjiao is actually a big area. And then lung, of course. Just now, actually pay attention not only to the fact that you're in the channel, hopefully. Here's the place at lung 6 where you could go towards this official lung 5, or there's an often better space right through here to lung 5. What I was going to say is pay attention to the texture of what you're feeling. Hard, soft, shallow, deep, you know. Pay attention now to what you're feeling and see if you can describe it. And David and I will come around and you can tell me what you're feeling. On those two channels first. And then see if you can find things that are diagnostically useful. Comparing left and right also, especially on Yang-Ming channel. Maybe there's something clear on one side and not on the other. Maybe it's the person's shoulder or something in their head or face too. So see if you can use it that way. If anything, it's a little bit deficient. I feel the nodules you're talking about, but compared to most people, they're not so big. Okay. In other words, yes, they're there, but feel her lung channel next. You'll feel the difference.